I'm Rick McGuire, the executive editor of CardioSource World News, and I'm with Dr. Bo Hawkins. And we're talking about carotid stenting. This is an issue that is rather important. You've had a paper which is actually NCDR data, correct?
Correct.
And since your family, what would you like to tell us about the data that you've just been presenting at SEAI?
Okay, well, thanks for the opportunity. Carotid stenting is a relatively new therapy for the treatment of carotid stenosis, and what we've learned over the past few years is that our ability to predict which patients are going to be prone to having adverse events following that procedure is somewhat limited. And actually, some preliminary work has shown some of the risk factors that are associated with adverse outcomes. However, there's no really comprehensive existing prediction model that can help both patients and clinicians determine what the risk of undergoing this procedure is. So within the NCDR registry, we looked at approximately 11,000 procedures, and we're able to come up with a set of clinical variables, 6 in total, that actually are very strongly associated with adverse events. And the adverse events we're talking about are very important ones. They include death and stroke. And so using this information, we were able to construct a risk score comprised of these 6 clinical variables. And this risk score gives us very accurate assessments of what a patient's risk of undergoing this procedure is. What this means for patients and clinicians is that now when a patient presents to us and is considering this therapy, we're able to look at them, look at their characteristics, and give them a very good sense and a very accurate sense of what their risks of having these problems following carotid stenting is. What that means from a clinician standpoint as well, which is just as important, is it also means that we can very accurately gauge patient risk. And if we deem the patient not to be a good candidate for this therapy, we can now offer them potentially other treatment strategies for treatment of their carotid disease. So I think in total what we're looking at is trying to apply this therapy to the right patients at the right time, and this should be hopefully a new tool that's able to do that.
How fast would it be to come up with somebody's risk score?
It can be done very quickly, probably in 1 to 2 minutes, I would say. As I mentioned, the 6 clinical factors are not any factors that need to they aren't factors that need invasive procedures. So I can see a patient in an office and quickly be able to estimate their risk with this risk score. I don't have to perform angiography on them, or I don't need other non-invasive testing to have that performed. So it's very quick, efficient, and easy to use.
And what are the 6 items you're looking at specifically?
So they include the following. Number 1 is a history of prior carotid endarterectomy. The second and third include age, as well as a history of atrial fibrillation. And then the final 3 are needing an upcoming surgery within 2 months, having a symptomatic lesion. And by that we mean you've had symptoms of stroke or mini stroke related to this carotid blockage within the past 6 months. And the last factor is having a prior history of stroke.
So this is based on NCDR data and on how many patients were analyzed?
It was slightly over 11,000.
Okay, so that's a good basis for analysis. You'll find the complete list and some details in CardioSource Interventional News, our sister publication.